right, so we'll dive right into it with the first original investigation titled Vascular Postoperative Changes Following Facial Flap Repairs: An Opportunity for Early Intervention by first author Hannah Berman and senior author Catherine DeGezis. Dr. Carr, what is your strategy for addressing unwanted postoperative telangiectatic change from flap repairs? And do you find these to be most commonly encountered with nasal reconstructions as the authors did in this study?
Yeah, so this was a nice little study looking at overall erythema and telangiectasia. I'm a big hands-off person, so I find in a lot of patients these will resolve just with some time. And so in many cases, we give it 4 to 6 months to really see if there's resolution, and if not, then often we'll intervene with pulse dye laser or something of the sort. This is sort of found out on this study as well, where they're really sort of noticing that telangiectasia is increased on the nose. They do make a comment that erythema is increased on the nose as well, but if you look at the numbers, it's really, really close. So it's primarily that telangiectasia. I'll note that I was a little bit interested that forehead didn't come up. I would say clinically, I really see forehead as having, a lot of telangiectasia issues in addition to nose. I would agree with nose for sure. So that was a little bit of a surprise to me. Another small comment is on the intro here. They talked a lot about shearing forces with undermining and things like that, and that sort of precipitating an inflammatory cascade. I will note that I see a lot of erythema or telangiectasia, particularly on the nose and forehead, even with minimal undermining. So I think this is probably a multifactorial kind of process that we're looking at. But yeah, so I'm a little bit more of a wait and see kind of person till about 6 months or so, and then we start making that decision with the patient whether or not we're going to intervene with pulse dye laser.
Yeah, those are great comments. I think, especially with regards to the undermining, I think you're kind of balancing, and I'm glad they kind of showed through that probably that wasn't as contributory as maybe previous studies have shown, because, it's a balance in terms of getting that plate-like scar to maybe protect against pin cushioning and things like that with wider undermining. So that was interesting to see.
Yeah, and I think in flap repair, you have no option, obviously, right? So they're talking about flap repairs here. So, you're going to undermine your flaps. You've got to get them to move. But even with, minimally undermined linear scars, we'll still get telangiectasia in certain of these high-risk areas. Obviously, this is outside of their study. The other thing that I always notice is, people with that history, which was hard to look at in the study, but things like rosacea, which they did bring up in the limitations that they weren't able to really look at. But those people that already have a lot of red on their skin tend to be the people that have a lot of red after surgery as well.
Yeah, great point.